Okay, let's get right into it. We're going to talk about a really big deal in your dental career, the Dental Core Training Situational Judgment Test. You've probably heard it called the SJT. In this explainer, we're going to demystify the whole thing for you. Let's do it. So, are you thinking about applying for dental core training? Maybe you've already started the application, or maybe you're just, exploring your options. Either way, you've landed in a perfect spot. This is for you. Because, let's be real, if you want to get that training post you've been dreaming of, you've got to get your head around the SJT. And that's exactly what we're here for. By the time we're done, you'll know exactly what you're up against and how to tackle it. All right, first things first. Let's break down the basics. What exactly is this SJT thing anyway? So, put simply, it's a test you take on a computer. It's designed to throw you into these realistic, everyday situations that you'd actually face as a dentist. The whole point isn't to trick you, it's just to see how you react, to check out your professional judgment. Now, here's something that should make you feel a whole lot better. This is not another clinical exam. I'll say that again. It's not testing your dental school knowledge. Whew, right? Instead, it's all about looking at those non-academic skills, things like your professionalism and how you handle tricky situations. So you might be asking, why even do this? Well, from the NHS's perspective, it's a way to level the playing field. It gives them a standardized tool to see if you've got what it takes beyond just your grades. They're trying to figure out if you have the right kind of professional behaviors to be a great dental core trainee. Okay, so now you get the what and the why. Let's peel back the curtain and look at the how. What does this test actually look like when you sit down to take it? Let's run through the numbers real quick. You're looking at 60 questions in total. Your whole appointment will be about 145 minutes long, but that includes time for a tutorial and a little survey at the end, so don't panic. And you'll take it at one of those official Pearson VUE centers. All right, this is super important, so lean in. There are only two types of questions you're going to see. First up are ranking questions. They'll give you a situation and a bunch of possible actions, and you have to rank them, from the very best thing to do down to the worst. The second type is more straightforward, multiple choice questions. Same deal, a situation, but this time you just have to pick the one most appropriate response. Simple as that. Okay, here's a massive piece of advice, a real pro tip. Listen up, there's no negative marking. That means you don't lose points for a wrong answer. So what does that tell you? You absolutely, 100% have to answer every single question. Never ever leave one blank. It can only help you. So what are these scenarios all about? What are they really trying to find out about you? Well, it all boils down to these four main areas. They want to see how you handle pressure, when things get crazy. They're looking at your decision-making. Can you prioritize what's important? A huge one is communication and patient care. And woven through all of that is the big one, your professionalism and your ethical compass. Okay, we've talked a lot about the test itself. Let's switch gears for a second and talk about the practical stuff, the nuts and bolts of actually booking it. Look, the booking journey is really straightforward, so don't stress about it. Step 1, you'll get an email inviting you to book. Step 2, you just hop on the Pearson VUE website and schedule your test. And Step 3, you show up and take it. It's pretty simple. And hey, just a quick heads up, if you happen to be applying from outside the UK, this is a global thing. These Pearson VUE centers are all over the world, so you should be able to find one that's convenient for you. All right, this next part is, well, it's the reason we're all here, isn't it? We need to talk about scoring, because how you do on this test has a massive impact on what happens next in your career. This is where it gets real. So how does the scoring work? Well, first, they scale everyone's scores to keep things fair, but you're not going to get a percentage or a raw number back. What you get is a band, from band 1 to band 4, and you're aiming for the top, because band 4 is the best you can get. Now look at this. This is probably the most important slide of the whole explainer. Why does the SJT matter so much? Because your final DCT ranking is split right down the middle. 50% comes from your interview score, and the other 50% comes from your SJT score. It's a 50-50 split. This test is just as important as your interview. Let that sink in. So just to be absolutely clear, how well you do on the SJT directly impacts your national ranking. And that ranking, well, that's what decides what jobs you get offered and where. A high score on this test can literally be the difference between getting the post you want and, well, not. Okay, so now that we know how high the stakes are, the million-dollar question is, how on earth do you prepare for this thing? Let's finish up with a solid game plan to put you in the best possible position to succeed. And really, this is the secret sauce right here. The best way to prepare isn't to cram or memorize a bunch of facts. It's about genuinely understanding what it means to be a good, ethical professional. It's about getting the GDC standards and the NHS values into your bones. So what's your strategy? It's simple. Just 3 steps. First, get to know those GDC standards and HNS values like the back of your hand. Seriously. Second, you have got to use the official practice paper. Work through all the questions. And third, and this is key, don't just learn the right answers. Ask yourself why they're the right answers. You're building up that professional judgment, that ethical muscle. I'm going to say it again because it's that important. The official HEC practice paper is your #1 tool, your best resource, hands down. Why? Because it doesn't just give you sample questions. It gives you the rationales. It explains the thinking behind the correct answers. That is absolute gold. Don't skip it. So when it comes down to it, try not to think of the SJT as just another hurdle to jump over. Think of it more as a sneak peek of your professional future. It's your chance to demonstrate that you have the character and the judgment to be a fantastic dentist. It's a preview of the professional you're about to become. So the real question is, are you ready?